Welcome to ABC Tutorial. Today we are going to talk about cerebellar signs. The cerebellum, which means little brain, is a structure of the central nervous system which functions to maintain coordination and balance. Cerebellar dysfunction causes difficulty with coordination, imbalance, and gait disorders. Possible etiologies for cerebellar dysfunctions include vascular, idiopathic, traumatic, autoimmune, metabolic, infectious, inflammatory, and neoplastic. Neurological evaluation is necessary for diagnosis and treatment. The signs of cerebellar dysfunction can be remembered by using the mnemonic Danish, which stands for dysdiadochokinesia and dysmetria. Dysdiadochokinesia is the inability to perform rapid alternating muscle movements, and dysmetria, which means wrong length, is the condition in which there is improper measurement of distance in muscular activities. Alright, the other cerebellar signs include ataxia, which is the lack of muscle control or coordination of voluntary movements, such as walking or picking up objects. Nystagmus, especially horizontal nystagmus, which is involuntary movements of the eye. Intention tremor, slurred speech, and hypotonia. The cerebellar signs once again is Danish, which stands for dysdiadochokinesia and dysmetria, ataxia, nystagmus, intention tremor, slurred speech, and hypotonia.